Hello everyone, welcome back to my channel. If you are new to my channel, my name is Cor and I'm your district nurse from Southeast England. Nurses in care homes play an essential role in ensuring that the person who we are looking after will be able to achieve a good death, which is dying with dignity, respect, and compassion. Moreover, providing utmost support to their significant others. Dealing with death is a common scenario in care homes as we are providing services to mostly elderly and frail people, and some of them are already under palliative care even upon admission. It is crucial that we will be able to identify that the person is in a dying phase, though it can be quite difficult to determine without a clinical eye or experience. These are the signs and symptoms of impending death and our role in end-of-life care. For your information, these manifestations do not have to come in sequence and may or may not be present in a dying person. Signs differ from each dying individual. Number 1, fluctuating state of consciousness. It can be observed that a person becomes less responsive and sleepy more often, and some may even have periods of unconsciousness. Some of the patients tend to get confused, experiencing deliriums, hallucinating, and become restless or agitated. Seeing patients in this state can be upsetting to their significant others. Therefore, it is important to have an honest yet careful end-of-life discussions in order to set realistic expectations. Number 2, significant decline in nutrition. A person is now less able to have food and fluid intake due to difficulty of swallowing, feeling sick, frequent vomiting, and decrease in alertness. It is important to make the family understand that the patient is not dying because he is starving. Instead, he is not eating because he is dying. Although in rare instances, some are given with artificial nutrition, but this tends to give the body a false hope and prolongs the dying process. Number 3, deterioration of bodily functions. Few examples could be decrease in mobility, loss of bladder and bowel control. So as the brain is losing its capacity to send signals to some organs in the body, it causes the sphincters to relax, hence a person becomes incontinent. Some patients ended up with catheters or continence pads. Number 4, irregular breathing. You may encounter patients having labored, shallow, or rapid breathing, even pauses or stops in breathing, which could last for 10 to 20 seconds. And on the late phase of dying, you will see patients who are in agonal breathing or gasping. In some cases, you will hear gurgling sound every time a patient breathes, and this is what we call the death rattle. Another sign could be skin changes. Skin can be cold to touch, and the color changes from pale to blue or cyanotic. In the late stage of dying process, some patients may have mottled skin. Now let's discuss your role as a nurse in the end-of-life care. I won't be tackling the technicalities and the paperwork, but more on your general responsibility. Our ultimate goal in the end-of-life care is to make patients comfortable through providing a palliative care. This entails managing the physical symptoms, offering emotional, psychological, and spiritual support to the patients and their significant others. I will divide this into 2 categories, the physical and emotional aspect of management. Let's tackle the emotional aspect of end-of-life care. The hardest question a patient or a family could ask you is, when? When am I going to die? Or when is my father or mother going to die? As much as it sounds confronting to hear that someone is talking about this or estimating your death, and although it can be unpredictable what will really happen in someone's last days or weeks of life, this will allow the patient and their loved ones to prepare mentally and emotionally, and will give them time to attend to practical things such as appointing lasting power of attorneys, funeral plans, and completing their wills. Having an end-of-life conversation will reduce their fears and help them to get involved in fulfilling the wishes and preferences of the dying. Another measure that could help is to set an open visiting policy, where families and friends could visit anytime they wish to, and without having any sort of restrictions. Providing constant reassurance to the dying patient, such as sitting with them and talking and holding their hands, will help them come and feel that they are not alone. Playing their favorite music or showing their memorable photos could ease their anxiety as well. As for the medical side of care, the focus is on managing the symptoms of the patient. For the pain, pain causes distress to a dying patient. You can address this by administering the prescribed painkillers, such as injectables, if oral medications are no longer tolerated. Example for these prescribed medications are morphine and oxycodone injections. Another problem is breathlessness and noisy breathing. This can be managed by changing position, providing fan or opening windows, or with prescribed medications such as Buscopan and oxycodone injections. I actually experienced some patients requesting to have a fan and they want it positioned facing them because it gives them a cooling effect somehow, and some of them also request to open the windows or the doors. They said that it helps control their body temperature as well as their breathlessness. Another sign and symptoms that you can manage is the excessive secretions or nausea and vomiting. This can also be relieved by repositioning, suctioning, and medications like Buscopan and haloperidol. Another manifestation is anxiety, agitation, delirium, and hallucinations. You can help the patient by providing reassurance and through administering medications such as midazolam or haloperidol injections. I've actually encountered a lot of patients experiencing agitation and hallucinations or deliriums during their dying phase. And it really helps just by sitting down with them, holding their hands, trying to reassure them as much as you can, and also by giving them their prescribed medications to help them relax. And I know a lot of nurses would agree that you have experienced patients who are seeing someone who have passed away. It can be their family member, their wife, or their husband, or their children, and they will keep on mentioning the name of that person. So what they're experiencing is hallucination. What you can do during that moment is to provide them as much as emotional support that you can give to them. It is worth to know that patients may stay on a terminal phase for an extended period of time, which can be distressful for both patients and their families. Hence, seeking support from palliative care specialists is also imperative. A concrete example of this team is the SUE Rider. It is composed of nurses who specialize in palliative care. Their inputs are highly significant because they have vast knowledge and training when it comes to palliative care. Being a nurse, may it be in a care home or hospital setting, we nurses are part of the best and the worst moments of our patients. But being able to give them a good death is truly a privilege. So hopefully you find this vlog informative. If you find this valuable, please hit the like button, and you can share this video to nurses who want to learn more about end-of-life care. And if you're watching this video but you haven't subscribed yet, what are you waiting for? Please hit the like button and subscribe to my channel and turn on the notification bell to keep you updated if I release a new video. Thank you very much for watching, guys. I'll see you soon. Bye-bye!